Perfect. Hi, guys. My name's Naomi Desai. I'm a fourth year medical student at Loyola University Stritch School of Medicine in Chicago. Here today, I'm presenting a case report about vaping-induced diffuse alveolar hemorrhage complicated by pericarditis in a 19-year-old. So this was a really interesting case for us on the floor. So just kind of go a little bit in the case. This was a previously healthy 19-year-old male that presented to us with acute onset hemoptysis that he had never experienced before, about 250 milliliters, in the setting of chronic drug use. So he was vaping chronically since the age of 13 and also using marijuana, and then recently started using Percocet in the form of snorting. So on arrival, he was hemodynamically stable. His vitals were stable. He was well appearing. He was really anxious due to his hemoptysis, but he was in no respiratory distress. He was saturating well, and he wasn't having any episodes of hemoptysis when he presented to us. So on presentation, multiple labs were ordered and a CT chest was ordered as well. And that was negative for a pulmonary embolism, but it did demonstrate a pattern consistent with diffuse alveolar hemorrhage. So that you can see in these two pictures here. As you can see, particularly on the right side, he had diffuse ground glass opacities bilaterally. He also had this patchy consolidation that was consistent with a diagnosis of diffuse alveolar hemorrhage. To kind of help figure out the cause of this, labs for vasculitis, autoimmune diseases were obtained, including an ANA, ANCA, anti-GBM, and quantiferin gold were all received, but all of them were unremarkable and did not come back positive. At the time, because of his chest pain, he was also ordered an EKG, and he was found to have ST segment elevations and PR segment depressions consistent with a diagnosis of acute pericarditis, which you can see in this EKG present here. He was also noting positional chest discomfort, which is consistent with a diagnosis of acute pericarditis. And then a TTE was obtained as well, which showed a trace pericardial effusion. So the diagnosis of pericarditis was also made. So just to go a little bit into the background, diffuse alveolar hemorrhage is a highly variable clinical presentation, and it's defined as bleeding into the alveolar spaces from the pulmonary microcirculation, and it's often associated with vasculitis, causing the vascular injury. So it was a primary reason that we order these vascular exams or vascular tests. And it can also originate from vascular inflammation due to inhalation injury or cytotoxic drug therapy that we know of currently. But currently in the literature, there's only a few case reports about vaping-induced lung injury and only one or two specifically causing diffuse alveolar lung hemorrhage. Typically, we've seen other lung injuries, including bronchiectasis, pleural effusions, hypersensitivity pneumonitis, but there's very few reports out there of it causing diffuse alveolar hemorrhage specifically. Then in terms of pericarditis, this is the disease process that's defined by inflammation of that pericardial sac. And the etiologies typically fall into either infectious or non-infectious causes. And the diagnosis will require at least two of the following, including characteristic positional chest pain that's relieved when sitting up and leaning forward, the pericardial friction rab that you can hear in auscultation, the characteristic EKG changes, which we're seeing here, and then new or worsening pericardial effusion. So he actually had three of these. We weren't able to appreciate a pericardial friction rub for him, but he did have 3 out of the 4 criteria. So going a little bit further on in his course, the clinical diagnosis of diffuse alveolar hemorrhage was made. And at the time, we did not decide to order a bronchoscopy to evaluate through a BAL, specifically if it was DAH. It was just medical decision making at the time. It wasn't decided on upon the team. Due to his cessation of bleeding and lack of respiratory distress, they didn't want to go forward with that. And then it was a very interesting case to us, and it kind of led to a lot of discussion amongst my team at the time because it was unclear if his concomitant pericarditis was the consequence of his inhalation lung injury. He had no other reason at the time to be presenting with pericarditis, no recent infection, no, nothing pointing us towards a reason to be presenting with pericarditis. So he was ultimately treated for it. He was given the colchicine 0.6 milligrams twice daily. And due to his increased risk of bleeding and the presentation with diffuse alveolar hemorrhage along with the pericarditis, they did decide not to proceed with the high dose ibuprofen, just because of the complications with the bleeding. They didn't want to proceed with that. But he was scheduled to follow up with cardiology and repeat with a chest x-ray 3 months later, which we still don't have the final results on yet, but hopefully he resolved well on that upon discharge. So generally, in conclusion, I think it's very important to kind of have more medical research out there about the long-term consequences of these e-cigarette and vaping induced lung injuries that are possible. The use of them has like dramatically increased in the past years, and the medical complications are still widely unknown, and the presentations can vary very widely. So this just emphasizes the importance of the pediatric and adult providers to be aware of the prevalence of vaping amongst the patients, and counsel patients the potential life-threatening respiratory complications, as well as just increasing awareness and research on this topic as well.